Hello everyone, now let us discuss about part 2 of powders. This is the final part. Coming to the preparation of powders. Preparation of powders involves the following steps: particle size reduction, preparing a homogeneous mixture, and packing of the powders. Coming to particle size reduction. For the preparation of powder, each ingredient should be kneaded in a finely ground form. Hence, manufacturer must use a number of procedures and equipment to reduce the particle size of powder granules, and this process is called as comminution. The most common method used for particle size reduction in the powder formulation is trituration, which involves placing the solid in a mortar and continuously grinding the chemical between the mortar and the pestle using a firm downward pressure. The powder must be frequently scraped from the sides of the mortar to ensure that all particles are evenly reduced and mixed. A levigating agent such as glycerin may be added to the solid and processed by either continued trituration or by placing the mixture on an ointment slab and using spatulation to wet the solid and further reduce the particle size of the powder after it has been triturated. In laboratory scale, trituration, pulverization and levigation are used for particle size reduction. Whereas in industrial scale, bowl chopper, hammer mill, roller mills, attrition mill, colloid mill, ball mill, advanced size reduction technologies and microfluidics particles reduction are employed. Coming to the factors affecting the size reduction: hardness or strength of the compound. Harder the material, more difficult it is to reduce the size. Toughness is more important than hardness. A soft but tough material may present more problems in size reductions than a hard or brittle substance. Toughness is encountered in many pharmaceutical materials, particularly in fibrous drugs, and is often related to moisture content. Next is stickiness is a property that causes considerable difficulty in size reduction. For materials, because the material may adhere to the grinding surfaces or meshes of the screen, may become choked, or if the material is gummy or resinous, it may be troublesome to size reduction process. It can be overcome by addition of inert materials such as kaolin or sulfur, kaolin to sulfur. The next factor is softening temperature during the process of size reduction. Usually during the process of size reduction, heat is generated which causes some substances to soften like waxy compounds. Example, stearic acids, drugs containing oils or fats. To overcome this problem, by cooling the mill either by water jacket or by passing a stream of air through the equipment, we can reduce this problem. Material substance will also affect the size reduction. All substances are not homogeneous in character. Some show special structures like mineral substance, which may have lines of weakness along the material splits to form flake-like particles, while vegetable drugs have a cellular structure often leading to long fibrous particles. So material, the type of the substance also affects the size reduction. Next is moisture content. Moisture content influences a number of properties that can affect the size reduction like hardness, toughness or stickiness. Next is purity required. Certain types of size reduction apparatus cause the grinding surfaces to wear, and such methods must be avoided if a high degree of purity of the product is needed. Coming to preparing a homogeneous mixture. Powders may be mixed by any one of the following methods. The first one is spatulation, next is trituration, next is geometric dilution, sifting and tumbling. Sifting and tumbling. Coming to spatulation, in this method, mixing of powders is done by the movement of a spatula throughout the powders on a sheet of paper or on porcelain tile. This method is very useful in mixing a small amount of powder or solid substances that liquefy. Example, eutectic mixtures. Next method is trituration. It is used for both size reduction and to mix the powders. If a particle size reduction is desired along with mixing of powders, a porcelain mortar with a rough inner surface is preferred to glass mortar which has a smooth working surface. Whenever both size reduction and mixing is desired, A rough inner surface. Porcelain mortar with a rough inner surface is preferred. Surface is preferred to a glass mortar with a smooth working surface than a glass mortar with a smooth working surface. The next is geometric dilution. This method is used when potent substances are to be mixed with large amounts of diluent. The potent drug is placed upon an appropriately equal volume of the dilute in a mortar and the substances are slightly mixed by trituration. A second portion of diluent equal in volume to the powder mixture in the mortar is added and trituration is repeated. The process is continued adding diluent equal in the volume to the mixture in the mortar of each step until all diluent is incorporated. This is called geometric dilution. Coming to the example, if 100 mg of potent drug is required to be mixed with 900 mg of lactose, then according to the geometric dilution, the following procedure should be followed. First, 100 mg of potent drug plus 100 mg of lactose. This becomes 200 mg of mixture. Next, in the second step, that is in second dilution, 200 mg of the mixture plus 200 mg of lactose. This brings to 400 mg of mixture. And in the next step, 400 mg of mixture plus 400 mg of lactose. This brings to 800 mg of mixture. And finally, this 800 mg of the mixture plus remaining portion. And that will be equivalent for 1000 mg of mixture of lactose. Lactose and drug. 1000 mg of potent drug and lactose. Coming to next method, that is sifting. The powders are mixed by passing through sifters. This process results in a light fluffy product and is generally not acceptable for incorporation of potent drugs into diluent base. Next method is tumbling. In this process of mixing powders, this is a process of mixing powders in large container rotated by an electric motor. These blends are widely employed in industries as large volume powder mixtures. Equipments used in powder mixing are tumbler mixing, tumbler mixer, ribbon mixer, screw mixer, etc. Factors that influence the mixing quality such as mixing time, speed of mixing rotation, type of the mixture, dry or wet mixing process, and so on, they affect the overall homogeneity of the mixture. Coming to packing of powders, bulk powders for external use are often dispensed in a shaker top container to facilitate topical application. They may be dispensed in a wide mouth jar or plastic container with flip top lid. And the jar or plastic container can be closed tightly to provide increased stability and protection from light and moisture, especially for compounds that contain volatile ingredients. And package should contain a label for external use only. In the packaging of bulk powders for external use, the label must contain for external use only. And the bulk powders intended for internal use should be dispensed in an amber colored wide mouth powder jar with a tight fitting lid. They should be accompanied by an appropriate sized dosing spoon or cup and adequate directions for removing and administering a correct dose. The bulk powders for internal use should be labeled with the strength of the active ingredient per dose. And powders can be wrapped in paper, weigh the required number of powders and wrap in papers. White gauzed paper is generally used for wrapping. And the wrapping should be done on a clean tile or large sheet of a gauzed paper to protect the product. In a well wrapped powder, there should be no powder within the flaps or folds. And when powder is opened for administration, the powdered material should appear in the center of the paper. Coming to double wrapping. Double wrapping is essential for volatile or hygroscopic drugs like menthol, thymol, citric acid and pepsin. Double wrapping is must for drugs. Those are sensitive to the atmospheric conditions. And for this purpose, a wax paper is cut slightly smaller than the demi paper each way and fold both the papers at once, similar to single wrapping methods. Coming to labeling, patient should be instructed that individual powder should be dispersed in a little water or placed on the back of the tongue before swallowing. Coming to evaluation of powder, pharmaceutical powders are evaluated for following quality control parameters. The first one is content uniformity, particle size and size distribution, flow property, angle of repose, flow rate, density, bulk density, tab density and true density and harshness ratios. All these things are employed to determine the flowability. Next is moisture content, tensile and cohesive strength measurements, safety and efficacy of the powders is also evaluated. Thank you for watching. Please subscribe for further videos on pharmaceutical sciences and other related disciplines.